How you doing? I'm Tyson Franklin, and with me is Jim McDannald, my partner in crime and co-host. Today we're talking about, this is episode 2, we're talking about what is marketing? Big question mark. Jim, how you doing?
Doing well. Looking forward to this topic. Yeah, I'm happy to get into this second episode. That's a deep question. Do you have like 2 or 3 hours for us to jump into it? How long do we have?
Oh, really, we worked out we're going to probably do like 20-minute episodes on these topics, so people can sort of, if they just find the podcast, once we're up to about episode 400, they can just plow through them.
Yeah, they can spend a holiday listening to the sweet tones of Tyson Franklin, Jim McDannald in their ears. But I'm excited about talking about what marketing is and what marketing isn't. So in your mind, Tyson, when you think marketing, what comes to the top of your mind?
Oh, what's funny, it's what you just said then about what marketing isn't. And I think sometimes people get advertising and marketing completely mixed up. So to give you a perfect example, would whether you're doing a magazine ad or a newspaper or Facebook ad. An ad is advertising. You know, you do up an ad, you put it in the newspaper, that is advertising. Marketing, in comparison, is the font you use, the headline, the text that you put in it, the page, the color of the ad, the photograph, the position of where you place the ad. So advertising is advertising, but it's one little part of marketing. So marketing is covering all aspects of an ad. I don't know if that actually answered the question, but that tells you the difference between advertising and marketing. But I actually think, to me, marketing is everything you do, especially for your podiatry business, from the time you wake up in the morning till you go to sleep at night. I think you're marketing your business.
I have to tend to agree with you. Like, it's really the deliberate actions you take, and sometimes even, I guess, the indeliberate actions you take. To me, really, marketing is about, it kind of comes down to the word market, right? There's a supply side and a demand side, and there's, no shortage of other specialties, or orthopedics, chiropractors are trying to get in, physiotherapists. There's a lot of people that are trying to, treat people with foot and ankle issues. But just how do you separate yourself? How do you display your expertise to your ideal patient in your local community and make them aware that you are that expert? And yes, word of mouth will work, and treating patients well are 2 great ways of doing it. But these days, when people have problems or they have issues, foot and ankle related issues, they're on Google, they're searching their Facebook group friends to try to find where they should go and who they should trust to be that kind of dedicated foot and ankle expert. So really making your services aware and kind of being visible to your ideal patient is kind of what the name of the game is in 2021 and I guess going into 2022 in my mind.
Yeah, and I think it's one of these things when you spoke about how do we differentiate ourselves from the other professions that are trying to treat foot and ankle problems. And I think this is where some podiatrists make the mistake where they try to be the same as everybody else. Yeah, the physiotherapist, the chiropractor are saying, we fix ankle problems. Now, if you're just saying we fix ankle problems and a patient's there going, oh, okay, you all fix ankle problems, so it doesn't matter where I go. So you've got to somehow get that message across to them differently.
No, 100%. You have to do that. But plus, I think a lot, especially in North America, at least, a lot of people, they go to university, they go through podiatry school, they go through a residency that's heavily hospital based. And you kind of get into this mentality that if I put my head down, I work really hard, I treat people really, really well, then patients will kind of automatically find me. And like I said, these new channels and these ways that people are gaining awareness about expertise, that's not necessarily the case. You really have to, like you talked about, you have to zone in on what you want to do and the care you want to provide, and then kind of show that to the world in a way that's, obviously honest and genuine. But you can't be shy about your expertise or your training or what makes you different from somebody else is actually the reason that people are willing to choose you. You don't want to have a cookie cutter website that's the same as the other 5 podiatry clinics in town where there's no aspect of differentiation. So to me, having a subspecialty or differentiating yourself from other podiatrists, other healthcare providers is vital to the health of a business.
Yeah, I'm always looking at podiatrist websites, and it's surprising how many podiatry websites just use stock photos. So they have the whole website, and they've actually got some good copy in there. you'll read through the articles and go, this is written really well. It's written for a 12-year-old as it should be. But all their photos, and then you'll click through 5 podiatry websites and they're using the same photos. Or then you'll go to a physio website and they might be talking about, say, an ankle problem, and they're using the same photo. And a friend of mine, Nikki Jerd, she always says on some websites, especially on medical websites, there's this guy that they call Same Guy. And he just looks at really honest looking middle-aged gentleman, and he just pops up on all these different websites. So everybody in her business refers to him as Same Guy. Hey, look, Same Guy's back on. So one of the tips she said is, like with your website, if you want to differentiate yourself from everybody, is get a professional photographer to come in, or have somebody in your business that has a good camera, like your iPhone cameras are pretty good, and actually take photos of you performing that service or your actual business with people in the photographs. So when people are looking through it, they're looking at your website, they're looking at somebody else's, and they go, oh, I can actually tell the difference between them now.
Yeah, it's like having the difference between the kind of the footprints in the sand on your homepage versus you treating your ideal patient. Let's say you want to treat runners. Is it going to connect with people who are a runner to see footprints in the sand, or to see you at the local marathon tent, treating a blister or something? So you're right on the ball there. I think another aspect of it that's really important to note is that, depending on what stage of practice somebody is in, is going to kind of change that kind of marketing mix. There's kind of we've talked about in a previous podcast, the kind of digital versus old school, and it's kind of a combination of those two things. But also comes down to, what do you have time? Is it time versus money, for example? If you're just starting off in practice and you have a lot of time, maybe that's time when you're, visiting other clinics, I guess during non-COVID times, or volunteering at a marathon if you want to do sports medicine, or going to running shoe stores and providing injury clinics and being known because you have the time to spend outside of your clinic. And then once you have more money coming in and you have less time to go do those things, ramping up other aspects of your practice, bringing on a marketing assistant or a marketing provider, or other ways to help, you identify those ideal patients and go after them in those areas where they are. There's different ways to use marketing. So there's not necessarily one right method for every single practice.
Yeah, I definitely agree that when you're first setting up, is you do the groundwork. Is you need to have somebody who's looking after your practice when you're not there, a receptionist. And when you're not seeing patients, you need to be out of your clinic and you need to be doing face-to-face meetings, getting along to networking events. One of the best things I went to was Cairns Businesswomen's Club. I was a member of the Cairns Businesswomen's Club. And being a guy at the Cairns Businesswomen's Club meetings, you used to stand out. When there's 250 women and one bloke, you tend to, but then it sparks conversations, and then you're there with your shirt on, and then sometimes we'd take other staff. Yeah, as we grew, we'd take other staff to those sort of meetings. Chamber of Commerce. When I first set my practice up, the networking events that I went to and the people that I met over a number of months were the same patients that I had 20-something years later when I sold my practice. These people were still coming in. I'd look at their patient file and go, wow, I've been seeing you for over 20 years. And it all stemmed from the original groundwork. The doctors that referred the most people to me were the people I went out of my way to create a relationship with when I was quiet. But then when I got busy and I didn't have as much time to do these things, they still remembered me. I didn't have to be in their face all the time.
Yeah, it's just like you said, right? It's about reputation and relationships. I think sometimes when we're younger and we think we're just going to work hard, and like I said, the patients are just going to start walking in, finding our door and walking straight in for an appointment. But, it's these network effects by building relationships, providing great care, and building a reputation over time that, helps generate some of this digital, some of this regular word of mouth. But then there's ways of, generating digital word of mouth as well that helps extend awareness about you and your services, but also, things like Google reviews or Yelp reviews or health grades. There's other ways that you can kind of put your reputation out there and let people show that you are kind of that go-to expert in your local area.
So when it comes back to the original question, what is marketing? And then I said, I talked about the difference between advertising and marketing. And then marketing is everything from the time you wake up in the morning till you go to bed at night. I actually think a lot of people, they drop the ball in certain areas. So signage is part of marketing, but your brand is part of marketing. You're handing an orthotic to a patient over the counter. When that patient receives that orthotic, or when you're doing the fitting in the room, or you might be doing an adjustment and giving it back to them, everything that you hand to that patient, whether it's an orthotic, a flyer, a handout, there has to be a commonality, a brand that's built around everything that you're doing as well.
I totally agree with that. And I think part of it is that, especially people go into private practice, maybe they have a little bit more of an entrepreneurial spirit and are kind of used to that. But I think, like I said, a lot of times in North America these days, it's a really hospital-based, training system. So, I mean, there's some residents will get into a clinic and see that. But sometimes it's just really kind of like learning on the fly that those things are important, that they do have an impact, because I think what sometimes people that go into medicine, at least in North America, this is just my perspective, is that, they don't want to be seen as a salesperson. They don't want to feel like they're coercing a patient in any way. And sometimes that sales, that kind of like the hard sale or the cold call things that they have, even people in practice are probably receiving cold calls from marketing agencies about, like, we're going to bring you 60 to 100 more patients per month, right? And that just, it kind of makes everybody's stomach churn when you hear that. And I'm someone that does marketing myself. So,
True.
When marketing gets kind of wrapped into this hard sell, this cold call, this kind of association with it, like, it can be something that people want to back away from and say, oh, I don't need that. I've got, I work really hard and I've got good word of mouth, but it's not necessarily about that. I think marketing can be a tool that really allows you to provide excellent care to even more people. You're actually, by putting yourself out there and the great care you provide, you're doing your community a better service by shining a light on your expertise and the unique value that your care provides. I mean, obviously other people in your community do a great job as well, but this is an opportunity. It's not a self-serving thing. It's really about being a steward and contributing to the overall health of your community.
I like what you said then about the sales too, because sometimes when I've had other podiatrists work with me, or you'll be at a conference and you'll talk about marketing, and straight away people think marketing is just sales. And in their head, like you said, they've watched TV, or they've grown up seeing these, what you class as these dirty salesmen that come in and try and use these tricky tactics to try and get you to buy something. And to me, I think if a podiatrist is actually doing that, then they're not the sort of podiatrist that I want listening to this podcast, or that I want to work with personally. To me, it's really, you're trying to help the patient the best you can by presenting them the best treatment in the best format. And you're trying to educate the public in the best format and the best way, so that they come and see you and they don't go and see the sleazy podiatrist down the road who is trying to sell them something that they don't need. So to me, I always say the definition of sales from a podiatry point of view is professionally helping people buy. But it's helping them buy the treatment plan that is the best for them.
No, I totally agree with that. And I think a lot of these tools, these kind of cookie cutter systems, or, patient growth or systems, kind of like, they want to be kind of a all for one, and, one thing that does many things super well for every single practice, but it's not really like that. And you really have to understand, kind of take a step back and understand kind of what is it that you want to get out of the profession and what brings professional satisfaction in the care that you provide. And by doing that, you can kind of create a marketing plan that's unique to you and to your practice. Like you mentioned, not only are you just putting yourself out there and shining a light on the care you provide, but there are some tools that do make the in-clinic experience for patients that much better. If I can fill out my health records forms at home from the comfort of my own home on my phone or my computer, and then just go almost straight into a treatment room, I'd much prefer that than sitting a half an hour in a waiting room. If I can pay a bill online and not have to be on the phone, that's beneficial for the patient who's paying the bill, but also for the staff that's trying to provide a great in-clinic experience for the patient. So there's a lot of technology and marketing tools that can be utilized to improve not only the patients that are coming to you, but the experience you're providing for your patients.
Oh, I think an internal marketing tip that I usually say to everybody, run on time. It's not that hard. Book in a certain amount of patients per day, stick to the time frame with that patient, and run on time. And then if you do run on time and you can do that, some patients will actually pay more if you can guarantee that you'll run on time. Because like I'm busy, if I have an appointment at 12 o'clock and they say it's going to go for half an hour, I base my day around that. If I rock up at 12 o'clock and all of a sudden I'm waiting until 20 past, I start to get annoyed. I would rather pay a fraction more and be on time.
No, 100%. And I think that's probably something we'll touch on in a future podcast is the positive marketing effects of running your clinic on time. I think that not only does that, that creates a great affinity of that patient, but I think that becomes what I call like digital word of mouth, or something that people really want to share with others. And I think that's one misconception about some of the things that happen now with marketing your podiatry practice, especially around patient reviews, is that, oh, I don't want to inconvenience the patient by asking them, or, oh, that just feels like, I don't feel right about asking them to fill out something online for me to talk about their care. But really, if you're providing excellent care for people, you're probably, servicing a local community or an area, they'll be more than happy to share that positive experience. And so other people in your local area can experience the great care you provide. So that's just kind of touching on what you're talking about there. But I'm excited to talk about that topic in the future as well.
So just to finish up, I want to just briefly touch on, and a lot of the topics we're going to talk about, like in these first few episodes anyway, we're going to dig into a lot deeper. And there's going to be times we may repeat certain subjects because we need to dig deeper with them. But paid advertising, partnership advertising, paid marketing, partnership marketing, and then content marketing. Do you want to explain part of that?
Yeah, I mean, there's obviously kind of different areas to go into with, when you're creating your own marketing plan, understanding kind of like, what stuff lives offline, what stuff is online, and just having kind of, a succinct plan or a succinct way to approach these different opportunities in your practice. So no, we'll definitely dig into that more later on in a future episode.
Yeah, because one of the things that I wanted to, because I know some people will have, say, like Facebook, for example, and my mum recently got booted off of Facebook, and that was her thing where she's on the Facebook Marketplace and sells plants, and all of a sudden she was taken off of Facebook, and she had no idea, and she said, I didn't do anything wrong, and sometimes that sort of stuff just happens, and you got to be careful of it.
Yeah, I mean, there's all kinds of stuff that can happen online, and knowing how to rectify the situation. I mean, obviously, if a common thing that happens a lot in the podiatry world is the kind of the nuclear negative review, and how do you react to that? Because react to that, and there's all these kind of different scenarios that we'll run through in future podcasts to help address some of these issues, hopefully.
Yeah, because marketing is so big. Just like a final question for you: do you think some podiatrists get afraid of marketing because it seems so big? You've got your paid, your partnership, you've got content marketing, websites and social media pages that people look at that and go, oh, it's just too hard. I'm just going to build my reputation.
Well, I think a lot of, at least people my age and a little bit younger than me and in your age, the way that the internet's used is totally changed in a way. I think, I think people do see the benefit of word of mouth, and some older podiatrists my age and older see some of the benefits of something like Yellow Pages and things. But for a long time, the internet and online was really just almost like a placeholder, almost like a brochure website. It was about having information and sharing, just kind of some basic information, but there wasn't much that was actionable as far as, really providing clear benefit. There was no kind of attribution about who was clicking on what, or exactly kind of like how could, surfacing in a Google result lead to a new patient. So it's taken a while, and I think Google and other types of places really try to like make it seem pretty simple when actually it's not super complex, but there are so many different options and opportunities out there. It can be a little bit of paralysis by analysis when it comes to starting a website or trying to get into Google Ads, the first steps are pretty easy as far as like, if you have the time, you can do it, but to do it really well and for it to generate business and a profit, be profitable with some of these endeavors is not always straightforward. So, I think our goal here is really to, introduce these different options that are out there. Like I said, there's no one cookie cutter solution that's going to work for every single practice. But, with our hope with this show is to introduce some of these options, talk about some general topics within marketing so that people feel at least educated, if they're confronted at a conference by, a marketing vendor or someone cold calls them, promising the world, that they feel at least a little bit informed so they don't feel like they're having the wool kind of drug over their eyes. At least have a general level of education on this topic to feel knowledgeable to have a conversation.
I love that. Yeah, education is the key. I think it doesn't mean, even if you don't like marketing and you're going to outsource it completely, but to me, you still need to have some understanding of what marketing is and what marketing is not. Like I said, I must get an email at least once a day. Hey, we can get you 27 to 30 new patients every month with this one email campaign. Just 5 easy steps. Please click on this link and be harassed for the next 12 months with an email every single day, which is what I've actually done accidentally. And what I find funny when they said, we have this email sequence that will guarantee you 27 to 30 new patients. The part that's weird about that, I don't know about America, but in Australia, we can't just cold call emails. We can't just send emails out to complete strangers. You get in trouble for that. So they're not new patients to start with. They're existing patients that they're trying to bring back. So they're not using the right wording. And then on top of that, depending on the type of clinic you have, how can the same email sequence, if it's exactly the same, produce the same results? So education is the key.
No, for sure. You got to be educated. And like I said, you don't have to be an expert in this stuff. And hopefully, by listening to the podcast and hearing some of the gems that Tyson's sharing and maybe a few of the ones that I'm sharing as well, you'll be well on your way. But it's just having some basic knowledge to have these conversations to feel, like I said, like you're in the game and, you're finding ways that not only benefit your practice, but also benefit the patients you're treating.
Yeah, and if you tune in next week, we'll give you a tip, an email sequence to bring you 27 to 30 games.
Don't make these outrageous claims. We're going to get all kinds of hate mail now, Tyson.
Sorry. Okay, I have nothing else to say on this topic, so that's it for me this week. Jim, I'll give you the final word.
Oh, no, it was good. I think we touched on some important topics with the topic of marketing, what it is, what it's not, and looking forward to some next steps with you as we continue this conversation.
That'd be awesome. Talk to you later.